Welcome, students, to the next episode of Learning with Lafferty. Like always, I've got to introduce you know who, Manee. Hello, Manee. So today we're going to be looking at all the blood vessels, and we're going to be using either you or the baby manatee to assist us in that process of going through the body, the arteries, the capillaries, and the veins. So let's start out with talking about, before we get into those arteries and capillaries and veins, of a little bit of reminder from the previous video that would have been talking about the heart. So the heart itself has 4 different chambers that I want to talk about. So the atrium's at the top and the ventricles at the bottom. Now from the ventricles, very important, the left versus the right. So from the right ventricle, we're going to be going to the lungs, and that is important because that is called a circulation, or the circulatory system that is pulmonary. So anytime you see pulmonary, definitely know we're talking about the lungs breathing, okay, which we'll look at into future videos. But in this case, we're looking at the oxygen exchange that happens between, of course, the air getting into our lungs. So we're looking at an exchanging that happens at these little things inside of our lungs called alveolus. And again, that will be kind of in future videos, but just kind of go ahead and putting that out for you. So as the right side, okay, the right ventricle sends through the pulmonary trunk through pulmonary arteries. So that is called the pulmonary circulation. So it goes from right ventricle to pulmonary arteries. Inside of the lungs, we're going to see capillaries called pulmonary capillaries. And then we're going to see pulmonary veins. And veins is what's going to bring it back to the top of the left side of the heart called the atrium. So we go from right ventricle to left atrium. Is all of that is considered to be pulmonary circulation. So from right ventricle to the capillaries inside of our lungs called pulmonary capillaries, that would be blue, purple, and then it picks up red to come back to the left atrium. So pulmonary circulation, okay, is from right ventricle to left atrium. Part of it's blue, and it turns purple because red and blue is going to come together, and then the rest of it's going to be red. So any circulation from back and forth from the lungs, receiving and giving from the lungs, is going to be pulmonary. Now the rest of the circulation is what I want to spend the majority of this video talking about, and you will definitely see in my demonstration of the arteries and veins throughout our body. And that is going to be called the systemic or systematic, okay, meaning the whole system of the body. So that is going to be the opposite side. So we're going to be in the left ventricle going out of the body through a thing called the aorta, the largest. Okay, then that's going to continue on till we get back to the right atrium. So left ventricle to right atrium, all of that is considered to be systemic or systematic circulation. So that's what, again, the majority that we're going to talk about. So a lot of red, okay, but eventually we're going to pick up blue, because then the blue is going to bring it back to the right atrium, and that process is going to start all over again to go where it needs to, okay, again, that figure 8 system that our body has. Now, we have 5 different types of vessels within our blood system. Okay, so the blood vessel system that carries and conducts the circulation of the blood and all that good stuff that's in our blood, even the bad stuff, obviously waste, is going to be arteries, arterioles, capillaries, venules, and veins. Now, arteries and arterioles, A for away, they always take blood away from the heart. That's important. So arteries and arterioles take blood away from the heart. Now the difference between an artery versus an arteriole, the arterioles are the ones that can do vasoconstriction and vasodilation, because they can have a narrowing or a widening, okay, inside the diameter. So the diameter is a little bit smaller than the biggest artery we have, which is your aorta. So it gets, again, the diameters are going to go down. So from an artery, an arteriole, then we come to the smallest of our vessels, and that is going to be a capillary. Now, definitely when you're watching that demonstration, I definitely want you to visualize this. It's important. that you understand that the capillaries we're not going to name independently. Now, they are different types of capillaries as far as the diameter of them and how they work, but we're not going to name them individually. But definitely know where you find a cell in the body, you're going to find a capillary. They call it the bed. Okay, we're a whole bunch of capillaries. So view it like arteries being the main road, capillaries being the parking lot, okay, and then veins are going to bring you back to your original start point. So the capillaries themselves, we have millions of them, okay, that connect to arterioles on one side, arteries, and then on the other side of that capillary, you're going to find the veins. Capillaries, you need to know their job, okay, because they do the exchanging. Okay, so anywhere within, I'll be future videos talking a lot about capillaries. So capillaries are exchanging, okay? They're exchanging all of that stuff that's within our blood that our cells that are nearby them need to receive. Now the last of the 5, so we have arteries, arterioles, capillaries, the smallest, the tiniest, is the veins. Okay, we have the venules and the veins. Now the venules, again, are the smallest of the veins, and we kind of pick up the diameter size a little bit bigger to get back to the vein. The veins as a whole, venules and veins, both carry back towards the heart. So arteries, A for away, veins back to the heart themselves. Now the jobs of them is going to, again, bringing that blood back, okay? And when we're thinking about pressure within these vessels, arteries are the highest, veins, barely nothing, okay? So we do have a little bit of pressure. Of course, we'll talk about that later on with capillaries, that exchanging that has to happen, of course, relating back to our blood pressure. But arteries are the highest as far as pressure. Veins have little to none, okay? So hence why you take blood from a vein versus an artery. Now, the structures of our veins have layers, okay, better known as tunics, okay? And of course, you're definitely going to see the tunics that I'll have within the demonstration next. Now, those tunics are as such, the 3: inside, middle, and outside. Okay, now the tunics refers to layers. So get back to the tissues of the body, okay, is very important to be thinking about. So, arteries and veins both have the 3. Okay, so all of our arteries, arterioles, veins, and venules all have the 3 tunics. Capillaries only have 1. Because of that exchanging, they only have that most internal layer that all of these have, arteries and veins and capillaries, which is the endothelium, the inner tunic, okay, the intima. Okay, so think of endo means inside, intimate with the blood. So that's the first and most deepest of the layers that the blood touches. It's very smooth, is going to be that particular tunic. So when you're thinking about the inner tunic, again, it's consisted of smooth muscle. It has an epithelial tissue. Okay, it's very simple. It's going to be squamous. Okay, so it's flat. Okay, so if you go back to remember what tissue, as far as that epithelial tissue, simple means it's just one layer of cells. So exchanging can happen very quickly. Okay, but it's helping, as far as the smoothness of it, is helping the blood to flow freely. Now the second tunic is important when we think about, especially when we think about constriction and vasodilation. Again, vaso referring to blood vessels. So middle tunic is the muscle, the myo layer. It's the thickest, okay, when you look at the 3 layers, and it has that smooth involuntary muscle. Again, we can't control it, but guess what does control it? The brain, okay, the autonomic nervous system. Okay, that's something that I would have talked about in previous videos when we talk about that parasympathetic and sympathetic, okay, vasoconstriction, vasodilation. Now the last of those layers of the 3 is the outside, the aventavia or externia, okay, the outside layer. This is going to have supporting connective tissue, okay, again on the outside, the most superficial of all of the 3 layers. So there are 5 different names associated with the blood vessels of our body. The first 2 are going to be arteries and arterioles. Okay, so I did the red for the most part. Most of them are red, but remember, arteries always carry away from the body. Now the arterioles connect directly to the next ones, which are the capillaries, and I put purple because red and blue come together. They are the exchanging vessels. And then capillaries directly connect to venules and veins. Okay, and I put them the blue because for the most part they are blue, but veins, no matter the color, carry blood away from the heart. So remember, arteries, arterioles directly connect to capillaries, and you have millions of these capillaries throughout our body. And then the capillaries then directly connect to the venules, and that's going to bring blood back to the heart. So A for away, capillaries do the exchanging, and veins bring that blood back to the heart. Now, the tunics are layers. They are membranes that protect the blood vessels. And they literally make the blood vessels. So from the inside to the outside. So tuna intima is endothelium is another name that you will see, but that's made of epithelial tissue. A tuna media or middle holds the muscles. And then a tunic aventavia or externia on the outside. Now, arteries and veins both have all three layers. Remember, when you're thinking about protection, it is very important to also consider the fact of, okay, if we want exchanging to happen, we need simple squamous tissue, one cell layer, and that is this particular layer. Capillaries only have this layer. Okay, so that's important. So when you see tunic intima, the internal layer, only capillaries have just one layer. Venules, veins, arteries, and arterioles all have all three of these layers. And what do those layers look like? So let's look at what those three layers look like. So as you can see on this one, there is only one layer, okay, and it's very thin, so it's going to allow things to come and go very quickly in the interstitial fluid bed where the capillaries live. Now, I've only done the red, okay, but remember, the veins also have all three layers. So I'll pull it apart here so you can see. So we have the inside layer, which would be the intima, which the blood directly touches. Then we have the middle layer that's going to contract and relax, and it's going to do that vasoconstricting and dilation. And then we have the outside layer, which is very hard connective tissue called the externia. So three layers that we have, tissue layers in our arteries and our veins. But in our capillaries, we only have that bottom layer, okay, that basement, okay, the internal part. Now, one thing to also remember when we think about blood vessels, even replying, of course, back to the heart, it is directly connected to the heart. All of these. Okay, we have one that's obviously more connected or closer or more proximal to the heart, but all of these vessels lead from the heart and lead back to the heart. It's a continuous highway, okay, that is going through our body. And all those blood vessels, as far as the elasticity of them, think about the stretchiness of them, and how compliant they are as far as being stretchy and moving. Okay, so think about it, I mean, they're all through our body, especially the capillaries, how tiny they are, is we definitely want some movement, okay, not very hard like plastic. We want that elasticity and the flexibility. So we think about conditions, definitely be thinking about, okay, what happens if that is no longer, it's becoming plastic, it could tear apart, degeneration could occur to it, or what happens inside of it if I get inflammations or if I get blood clotting that occurs in a little tiny tube. Okay, that is important. Now, the next part of this video is I'm just going to talk very briefly about the names, but I definitely want you to spend, obviously, all the time mostly watching the diagram to learn the names of these arteries and also to know the names of the veins that connect back up to the heart. Okay, now the capillary beds, you don't have to know the names associated with it, but always know in textbooks they just have the red and the blue. They don't have the purple, okay? But wherever an artery branches off, it branches to a capillary bed, and then it connects up to the veins, and that vein is going to bring the blood back to the heart. So pick areas, and that's what I want to do within the diagram, and that, of course, that demonstration for you is pick going from the heart, okay, first, then go to the head, okay, and back to the heart, and then go from the heart to the arms, okay, and then go from the arms back to the heart, and go from the heart down to my lungs, back to my heart, from the heart to my abdominal, my visceral, okay, remember the visceral cavity, that means belly, all that particular heart back to the heart, then go from the heart down to my legs, and then back to the heart, okay, it's the best way to learn it. Think along that route, if I had a hole in that straw, okay, that blood's not going to get to where it needs to get. And also remember that not all 4 to 6 liters at one time is going to the heart, okay, not all 4 to 6 liters is going to the head, okay. Again, these red blood cells that are going to be carrying the oxygen, of course, everything else, but especially we're worried about the red blood cells because of the oxygen. Our cells have to have oxygen, that they capillaries are so tiny that only one of those red blood cells can go through those capillaries at a time. So find a way that helps you. You definitely want to start with the aorta, okay, because that's the mother. Okay, so when you're looking at and reading in your textbooks and trying to understand all these different names, a lot of these areas you already know. Okay, so if you know names of bones, if you know names of medical parts of our body, regions, then you're going to be doing well, okay? But if some of that stuff, again, you still struggle with, going back to, chapter 1 in most textbooks are going to have those names there listed for you, okay? Or go back to the skeletal video and learn about the names of the bones throughout our body, because usually there's an artery or vein that has the same name. Now we're talking about the systemic arteries, okay? I already mentioned about pulmonary, so the systemic arteries, again, are going from the left ventricle to the largest of our arteries, okay, and that artery would be called your aorta. Now sometimes we just think the aorta is here, but it does start here, okay, so think of it in between your clavicles, the mediastinum region, but it goes all the way down to like your belly button region, okay. It looks like it's got a hook to it, almost relate it back to the look of a candy cane, and it has 4 different regions that will have branches that will come off it to supply the different areas. The heart, okay, because the heart needs oxygen first if it's going to continue to pump. Number 2 would be the head. Number 3 would be the arms. Number 4 would be the thorax. Number 5 would be the abdominal cavity, and then it branches there. It doesn't officially be called the aorta once it gets to a certain end portion. Then it's going to pick up and, of course, supply the blood down to the legs, the thigh, the legs, the feet, and such. Okay, the rest of the half of the body, okay, your lower extremities. So 6 areas, okay, and again, kind of learn it that way will definitely be helpful for you. So the 4 main parts of our aorta, in this order: ascending, arch, descending. Now descending is broken down into thoracic and abdominal pelvis. Okay, we don't want to forget about the pelvis because that's important. And then lastly, it ends at what they call the common iliac. So 4 names you definitely want to know what is coming off. So think about it. If I'm starting with the ascending aorta, what's the next little branch off of that? The name of the artery. Then we'll talk about the veins that come back and where it's going to come back at. Because remember, aorta is just about taking away. Okay, blood is not going to come back to the heart through the aorta. It's going to come back through the systemic vein, which is called the vena cava. Okay, so definitely know the aorta is taking blood away from the part, and know those parts. Now the systemic veins, the largest, and again, kind of the same thing you're going to see in the video. I'm just going to kind of bring you back and forth from the heart away and then back. Okay, so all the veins of our body bring blood back. Now the largest that ends at the right atrium is called the vena cava. Now you have a superior vena cava and an inferior vena cava. So superior is anything above the diaphragm. Okay, so we think about diaphragm, okay, everything above it. Everything below the diaphragm is inferior. But both of those meet right at the superior at the right atrium. Okay, and then the process, of course, will go to the lungs, and you kind of hopefully remember that pathway, okay? So when we're thinking about veins, we'll think about blue, mostly, except for when we talk about the distance between, again, the right ventricle to the lungs is going to be obviously different when it comes back for our scholars. But veins always take blood away way back to the heart. Veins always take blood back to the heart. So the largest is going to be the vena cava. That's important. So then you kind of have to go, like if you want to go backwards from that, but I would start wherever you branched off of to get back to the vena cava. And that will be definitely what I'll be showing you within the portion of the demonstration that will hopefully will help you. Now definitely understand arteries, again, the purpose of an artery. Again, artery carries the blood away from the heart. Veins carry blood back to the heart. Now in between that was a very important part called the capillaries. Now again, capillaries view the arteries, capillaries, and veins, again, like traveling, okay? So like getting on a bus and traveling around the city. So picking up and delivering passengers, such as like in a bus around your city, at each stop. And it takes the gas, and as the blood flows from the capillaries around the body, it's going to, of course, pick up oxygen and carbon and drop off carbon dioxide, or vice versa. Okay, that's going to happen, and we'll get to that part when we talk about the respiratory system in a few videos after this. Now, exchanging. Okay, now exchanging. Where does exchanging happen? It happens at a capillary bed. Every cell that is living in our body has to have a tissue fluid around it, okay? It's called the interstitial fluid. So the interstitial fluid, aka tissue fluid, is the fluid around, and it's very salty. And one thing to remember, salt and water, okay? Where it's salt, water wants to be there, and then vice versa, okay, itself. Now, it's important to understand that the fluid that's around the cells is kind of like that middleman to allow the exchanging to happen. So as the blood is flowing through, you're going to kind of see that within the demonstration of capillaries working as it's going through an artery and gets to the capillary bed, that exchanging between outside of the cell, inside of the cell, as the liquid leaves that vessel and mixes within that fluid, and then it's going to take back, once it gets back to the veins, back to the heart to circulate around again. Now that process is done mostly through diffusion. Okay, so think about diffusion again, back to way back within the chemistry part of high number to low number. So if I have a lot of oxygen within the capillary vessel, okay, then I want to go from high to low if it's on the outside. Okay, so from high to low number is always what we're doing. Okay, that's important when we think about diffusion. That's why it's the most used process within the body. From a high to low is at homeostasis itself. Now you can also have filtration, and the only difference between a diffusion and filtration, if you remember, is when we add pressure. And think about the pressure, the heart pumping, okay, so the faster your heart pumps, or should I say the more harder that your heart pumps, that's where we're going to see that the exchanging can happen, unfortunately, sometimes too fast, even when we think about filtration. So think about a waiter bringing you your food, and then as soon as they set it down, they take it away. Well, you didn't have a chance to get the nutrients that would have came from that meal. That's the problem with high blood pressure. Well, the problem with low blood pressure is kind of the opposite of that. Yeah, they leave it there forever, and maybe you consume more than you need. Okay, or a lot gets lost during that exchanging time also. Okay, so that's why we want homeostasis when we think about our blood pressure. Now, there are two names that you definitely want to be familiar with when you're thinking about right before the capillaries or the arterioles, is the words of vasoconstriction and vasodilation. And literally all that means is an increasing and a decreasing in the diameter inside of those vessels. So think about a smoothie straw versus a coffee stirrer straw. Okay, obviously that would be vasodilation, would be the bigger straw, and vasoconstriction would be the smaller straw. And think about the blood that has to flow through that. Now, I do want to point out, remember that all of our vessels at the same time, far as the arterioles, are not vasoconstricting, vasodilating all together. So when we think about the name of vasodilation, that is an increase in the internal diameter, dilation. And vasoconstriction is the internal diameter has decreased. Okay, and remember, this is a vasomotor autonomic nervous system that directly controls it. That's coming from the medulla oblongata. It's coming off that brain stem that regulates the changes when it's needed, such as we're cold. And remember, the body is about keeping the core part of our body warm and at the right temperature as much as possible. That's why, you know, when you're cold outside and you start to shiver sometimes, of course, it's going to warm up the body, but that's also changing the diameter inside of your arterioles to get the food that is needed throughout your body. And again, food, I don't want you to think about just like hamburgers and hot dogs. Food, we're also returning to oxygen. Okay, that's going to make that ATP the energy that our body needs. Now, there are 3 ways that this circulatory system is regulated by. So, contracting of skeletal muscles is a great way, and one of the ways that the body is going to get blood, especially around the body, but back to the heart. So, if arteries are the highest, think of a roller coaster ride. Okay, you start off with arteries of going up that hill, and then as you come down that hill and you get back to the gate, you get that chug, 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 the chain that pulls you back. Well, that's the veins. Now, arteries and veins are a little bit different inside. Arteries do not have valves, but veins do. Okay, and these valves are different than like the valves in our heart that again prevent things from going, you know, backwards, but it kind of is that. Because those valves in our veins are going to help prevent backflow, but also as muscles are pushing against those veins, those valves will shut off, but they push that blood back to the heart when those valves close after it goes from one section to the next. So that's why those valves, especially if you have conditions such as varicose veins, and we get a pulling back or a leaking of those valves, that's where you get more of the pooling of the blood. It's not being pushed back to the heart as quickly as it should. Number 2, besides the contracting in the valves, okay, would be breathing. Okay, so every time you breathe in, that changing in your abdominal thoracic cavity promotes blood return back to the venous system. Okay, so as that diaphragm, it flattens and that puts the pressure on the large abdominal vein, the chest then expands and there's a drop in that thorax. Together, those actions are going to push and pull blood through the abdominal and thoracic cavities and then return it to the heart. Now we're going to be looking at where the aorta begins, and then we're going to look at the parts of the aorta. So from the left ventricle, you notice that we're going to have a valve that's going to separate the left ventricle from our aorta. So the left ventricle valve has called the SL aortic valve. So remember, that's the valve that's going to be pushed open when enough pressure builds in our left ventricle. So then it's going to go to the aorta. Now we're going to look at the parts of the aorta, the 4 names associated with those regions. So I'm going to use Manee in this just the beginning of part, so Manee can have his cameo within the video of showing you the heart and showing you what the aorta looks like and the vena cava. And if you notice that the right side of the heart is going to be blue, and that's going to relate to the vena cava that attaches to the right atrium. And then on the left side of the heart, you'll notice the red is relating to the aorta, and that is coming out of the left ventricle. Now I want to show you on the skeleton so you can see what that would look like within the body. Now, as you can see on Mr. Skelly, you notice that I put the heart on the outside of the sternum so you can see it, so obviously it would be inside of the thoracic cavity. But you can see in this that the heart on the right side is going to be the top atrium, is going to be that vena cava, that long vessel. That's the largest vein in the venous system. And then on the other side of the left ventricle, that's where you're going to see this big giant, the largest of our arteries, that's going to branch off. So now we're going to connect these parts together. So the first part of our aorta is called the ascending aorta. Now, it is going to bring a blood supply directly to the heart through an artery called the coronary artery. Now, that artery then is going to go through a capillary next. And then after the capillary, we're going to have the vein called the coronary sinuses are going to be the names of the veins. Now, after the veins of the sinus inside of our coronary, our heart, the blood then is going to return to the right atrium through the superior vena cava. So the order of leaving the left ventricle, we're going to have ascending aorta is the first part of your aorta. Then we go through the coronary artery, go through capillaries that connect up to veins called the sinus, coronary sinus, and then that blood then is going to return to the right atrium versus the vena cava. So a very short passageway. And again, coronary literally means crown. And the sinus is going to be the veins that are going to be also like a crown that is going to surround the heart to provide oxygen to the heart. So from the left ventricle, baby manatee is going to go through the ascending aorta, through coronary arteries. The purple relates to capillaries, and then it's going to give the heart all that exchanging is going to happen to the oxygen and carbon dioxide exchanging. Then that low oxygen then is going to go back to the heart through the coronary sinus veins, back to the superior vena cava, and then that is, of course, going to then lead us to the right atrium. And definitely want to be thinking about if there is a blockage and blood is trying to get from the ascending aorta, coronary arteries, and if there's a blockage, then the heart is not going to get oxygen. Also think about if there is a hole in the vessel at the ascending aorta, an aneurysm, and if it was to pop, then blood-rich oxygen is not fully getting to the heart through the coronary arteries. All right, so the next part we're going to look at after the ascending aorta is going to be the aortic arch. So this little part here that's going to come and do the little arch is then going to branch in two different directions. So the arch is going to supply the head, which I want to look in this part, and then here in a minute we're going to look at it affects the arms. Okay, but let's look at the head first. So from the arch, the blood is going to flow to the brachiocephalic artery. Then from the brachiocephalic artery, it's going to travel to the subclavian artery. And in this case, then it can go up two different directions into the head. It can go up to the carotid artery or the vertebral artery, which is through the vertebrae, up into the head. Now then it's going to meet capillaries, and then after those capillaries, it's going to go out of the head through the jugular, through the subclavian vein, to the brachiocephalic vein, back to the superior vena cava, back to the heart. So remember, the blood flow from the aortic arch is going to be brachiocephalic artery, subclavian artery, carotid or the vertebral artery, to capillaries. And again, that's where the exchanging is going to happen. Oxygen, carbon dioxide going into the interstitial fluids. Then to go back to the heart, we got to go through the jugulars. Now I don't have it listed there, but there also is a vertebral vein also too. To the subclavian vein, to the brachiocephalic veins, and then we end up in the right atrium coming through the superior vena cava. And again, think about blockages. Okay, so I'm trying to get through that passageway. Can't get down, got a hole at the arch. So blood that's needing to get to the head then is not getting there. So then that could be also considered to be a stroke. And also think about if, those blockages along the way, that anything along this way, And then anything back to the heart is also not getting the blood supply that it is needed. Hopefully that helps you to see blood flow to the head. All right, now we are still in the arch. Okay, so from the arch now we're going to supply the arms. So kind of the same way, except we're going to branch off. Instead of going up, we're going to go down the arm. So from the arch, brachiocephalic to subclavian artery to our axillary armpit area, brachial, radial and ulnar, and then our palm, arch, and our digits for our arteries. And remember, there's going to be capillaries, okay, and then along that way, then the next areas are going to be the veins. So from capillaries to veins, we have the radial, ulnar, and obviously there would be some that would be veins first, the digits. Veins. These three veins are veins that we will take injections from. And remember, when you think about veins, also remember that there are some that are superficial and some that are deeper. And then we have the brachial vein, back to the subclavian, the brachiocephalic, and then back to the superior vena cava. Now, baby manatee is going to help us again. So we start at the arch, go to the brachiocephalic artery, to the subclavian artery, to the axillary artery, to the brachial artery, to the radial and ulnar arteries, to the palm arch and the digital arteries. And once we go through arteries, remember arteries always go to capillaries. Then after the capillaries and the vein side, we go from radial, ulnar, to at the elbow region, to the brachial, to the subclavian, to the brachiocephalic, and then back to the right atrium. Now it is important, and I didn't mention it in the previous part that I showed you, always important to remember. Remember, it does not have to go through all of these. When it gets to one area, goes to a capillary, then it's going to pick back up at the corresponding vein that's attached to the capillary and then go back. So an example of the brachial, if it travels all the way from the arch to the brachial, then it goes to a capillary, then it's going to pick up and then go through the corresponding brachial vein to go back to the vena cava. Okay, so I don't want you thinking it has to go through all of these to get back to the heart. It just has to pick up to whatever is attached. Arteries attach to capillaries, and those capillaries then attach to corresponding veins, and that is important. But remember, the vena cava is like the aorta. These always are at the beginning and the end of the line. Okay, that does not change. So if I have an aneurysm on the arch, not only could it affect the head, but could it also affect the arms. Okay, so everything downstream or everything upstream could be directly affected. Okay, that's important to remember. Think of aneurysms would be that little balloon if it popped, or if I have a blockage inside of the vessel, then blood downstream for arteries and then upstream for veins would be directly affected. So definitely need to be thinking about that. All right, now the next part, the third part we're going to look at is the longest portion of the aorta, called the descending aorta. Now it is broken into thoracic, and it's also, the next part will be the abdominal aorta. Okay, but now we're going to look at the thoracic. So from descending aorta, the first section is called thoracic aorta. Then we go to the artery called the intercostals. Okay, remember we have capillaries. Then a zygote vein, or the name of the veins that bring it back to the superior vena cava, back to the right atrium. All right, baby manatee's gonna swim for us. Okay, so he is at the descending aorta. Then he's going to go through that portion called the thoracic aorta to go to the lungs, through the intercostal arteries. Remember, there's going to be capillaries that connect up to veins, and the vein is the azygos, which is like a sinus that holds the blood to bring it back through the vein, through the superior vena cava. So when you're thinking about intercostal thoracic, if you think about an aneurysm on the thoracic aorta would directly affect the lungs. Okay, that is very, very important. All right, now the last most superior portion of our aorta is, of course, the descending. But the longest and most inferior portion is going to be the abdominal. Now, so remember, descending aorta is broken up into two parts. Thoracic is superior, abdominal is inferior. Now, one artery that I didn't mention before that I'm going to go ahead and mention now is the pharynx artery. That's going to supply energy and innervation to the diaphragm. Okay, so I definitely wanted to point that out so we make sure that you understand that. Now, so after the abdominal aorta, we go to the celiac trunk. Now, the celiac trunk is going to give life to gastric, which is stomach, splenic, which is spleen, and hepatic arteries, okay, which is the liver. Okay, so they call it the trunk as a whole. Now, after that is going to be the mesenteric arteries, which branch and become the arteries that supply the small and large intestines. The next is going to be renal, which supplies the kidneys. Gonadal, the gonads are the arteries that go to, in a woman, the ovaries, and in a man, the testicles. And then the very last portion of the aorta branches, and the end of it is called, of your aorta, the common iliac arteries. And we'll talk about here in a little bit when they branch to go into the legs. So remember, there's capillaries between all of those. So then it would meet up with the bottom portion is the common iliac. That's the end of the vena cava. Then it would go to the gonads, renal. Now the name that they give for the veins, far as the stomach, the spleen, the pancreas, and the intestines all go through the liver, and the liver has a vein system called the hepatic portal system. So it's a double filtration that is going to help through all of that enzymes of digestion to make sure it's filtered one more time, because the next stop after the liver then, the vein side, is going to be the inferior vena cava. All right, baby manatee's going to help us. So we're going to go through the abdominal region. So the descending aorta, the last portion of our aorta, can't think about belly button region, is going to be the abdominal aorta. Then the next portion it could go to would be the celiac trunk, which gives life through an artery to our stomach, our spleen, and our liver through arteries. Then the mesenterics supply the small and large intestine with arteries. Renal is going to be the kidneys, and gonads or ovaries in a woman, and testes in a man. So remember, there's going to be, the exchanging that happens at the purple, which is the capillaries. So then it could go back through the veins of the gonads, the renal, the kidneys, and then remember, the stomach, the spleen, intestines, and the pancreas all have a vein system going back through the liver, through the hepatic portal system, that's eventually then going to connect directly to the vena cava. So that one's very important. There's a little bit more information. Definitely make sure you understand that when you see the word hepatic, we're talking about the liver. And we'll talk about the liver again in future videos when we talk about digestion. But definitely go ahead and know now that those four organs send their blood back to the liver to get back to the heart. Okay, not directly. All right, the last portion we're going to look at is the descending aorta. Okay, so from the descending aorta, that, remember, eventually ends at the common iliac artery. Now that can split in either internal, which obviously services the genitals, or it can go then next down the leg through the external iliac artery. So common iliac artery is the end of the aorta. So external iliac artery to the femoral artery, to the popliteal artery, to the tibia and fibular arteries, all the way down to the foot to the dorsal pedis. And remember, after that, you have, of course, capillaries that meet along the way. And then going upwards, the plantar venous arch, supplying the foot. This is one we have not talked about because it is only a vein, and there's a great and less saphenous vein. Now, the greater saphenous vein is the longest vein in the body, and it is one that they use when they do bypass surgeries, or they're going to take from it. Okay, so definitely know the great saphenous. Tibial vein, popliteal vein, femoral vein, to the internal external iliac, up to the common iliac, and then lastly, of course, the inferior vena cava will travel all the way up till it gets to the right atrium, and then the blood flow starts again. All right, baby manatee's gonna make his last swim. So, descending aorta ends the aorta names at the common iliac. So from the common iliac, we've got internal, external iliac. Again, that would be inside the pelvis, outside. So if it's on the outside external, then it goes to femoral, the femur, popliteal space, okay, with that artery behind the kneecap, tibia and fibula, so tib and fib, the bones, and then dorsal, of course, would be the ankles and the foot. And then, of course, we got our capillaries. Then we go back through our veins. The arch venous, the foot. The great saphenous, remember, is the longest vein in the body. The tib, popliteal, femoral, internal, external, iliac, back to the common iliac, and that then connects to the inferior vena cava. So remember, blockages along this way, if you were to have a blockage or an aneurysm on the common iliac, it's going to affect either the pelvic region or the leg as a whole, thigh, leg, and below. Now, Manee wants to remind you, when you're thinking about the heart, that it begins at the aorta, first arteries, all of them, okay? Now remember, they will branch off to some type of capillary bed throughout the body. Now, they all end at a vein, which is the vena cava. And remember, there are arteries that connect the capillaries throughout the body, and those capillaries directly connect to those veins. Now, also, Manee wanted to remind you that Mrs. Lafferty did not cover all of the arteries and veins. There are a few more superficial ones or deeper ones. I've covered the major ones. Some of them come in pairs, some of them are independent, okay? But definitely the flow is still the same throughout the textbooks that you will read through. But those are the major arteries and veins of the human body. Sorry, Manee. Now, the next thing I want to talk about is blood pressure. So definitely need to understand what that word blood pressure means and what is relating to. So blood pressure is the force exerted by the blood against the walls of our blood vessels. So think about when the heart is contracting and the heart is relaxing. So we would have heard those names in the prior video, but the names for this week are going to be systolic, which is the maximum pressure that develops in the arteries after the heart contracts, so that pressing against the walls. And diastolic pressure is the lowest pressure measured in the arteries after the relaxing of the heart. So think about top number versus bottom number. Now, top number, the S, okay, and kind of back to systole, remember we talked about that in the heart video, and diastole. So systolic pressure should be about 115, 120, the top number. The bottom number, okay, diastolic, should be about 75 to 80. So again, 115 to 75 or 120 to 80. Okay, the American Heart Association kind of keeps going back and forth of what is normal tensive. Remember, normal tensive is just what normally your body should be. So anything above or below that is a problem, okay? Now, hyper, obviously anything above 120, top number, bottom number 80. Okay, anything below that would be hypo. Okay, of course we know kind of the conditions that can come from either side, but also thinking it back to the capillaries. If I'm sending blood too fast, I don't have time for my cells to get what they need. If I'm going there too slow, it also could cause things to build up within the vessel walls. But it's pressing. Okay, the heart controls it, yes, but also remember we're talking about what pressure is left over after I've gone around, and especially if we have high blood pressure, the problems that could affect the organs. Now, as far as what's controlling short-term versus long-term blood pressure, short-term is very variable. Okay, so think about when you wake up in the morning and you go to bed at the evening, your blood pressure has not been the same throughout the day. Okay, obviously when you're taking a test, probably your blood pressure goes up. Because remember, when the heart goes faster, then the blood pressure is going to follow it. Okay, usually. Okay, but it could be the opposite. But usually, if your heart rate is fast, pump, 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 your blood pressure is starting to rise, and vice versa itself. So that's kind of the short term. Okay, as far as it must be kept within a certain set point. Okay, again, that back to the homeostasis. Okay, itself. Now, what controls that? Cardiac output. Okay, kind of back to last week's video when I talked about cardiac output, heart rate plus stroke volume. So remember, stroke volume related to resistance downstream. Okay, so I have the heart over here, and I've got a arterial, and then right after the arterial we have capillaries, and then we have veins. Well, leaving the left ventricle, going downstream, I got a blockage here, so everything here can't get here where it's going to backflow. The heart's going to have to pump faster. It's going to cause the CO number to go up, okay, because of resistance that's happening. That also could be controlled, of course, mechanically, short term. Our body can do that by vasodilation or vasoconstriction. Controls, again, that CO, that cardiac output. Making the blood pressure high, making the blood pressure low. Okay, because our body needs to regulate that. As far as long-term aspect of it, that's where we think about the fluids within our body. That's going to change that. Okay, also, of course, hormones, salt, okay, all of those electrolytes, that plays a role long term. But short term, it's going to be directly that autonomic nervous system that controls the vasodilation and vasoconstriction. The long term results of that, as far as long term high or low blood pressure, does come from you problems. Okay, maybe eating too much salt in your diet, too much weight, okay, not enough exercise, things like that. And now pathologically, we can have problems that affect our blood pressure as far as the veracity. Okay, so an increased blood veracity increases your blood pressure. Okay, so when we think about veracity, we think about the thickness of our blood, so things that are within our blood. Okay, and that would be back to kind of the blood chapter when you're talking about the thickness of our blood. Now, compliance of the vessels also make a difference. So if we don't have enough elasticity, that also can change the compliance. That, again, could prevent blood getting to where it needs to go. Now, as far as measuring the blood, where's the best places to measure the blood pressure? Okay, now the blood pressure is in an artery. Okay, now the best place to get the most accurate is as close as the heart that you can get. Okay, that's why we use the brachial artery for the most accurate. Now you could use the radial artery, okay, in the wrist region to also get the blood pressure. Okay, and of course, obviously using a stethoscope. So when you're using a stethoscope and you're pumping up, literally when you have that cuff on the arm, when you're pumping it up, what you are doing is cutting off the blood supply to the artery, the brachial artery, if you're doing it here. That's what hurts so much, okay? Like your arm down is like, I'm not getting any oxygen, okay? Help me here. So as you're pumping, you're going to hear that sound appear with the top number, okay? So now when you let the pressure out and the sound starts to disappear as you let it out, that's going to be the bottom number. Okay, and again, it takes some time. Definitely want to practice manually to understand the difference between the top number and the bottom number. Okay, but that's literally what's happening. Okay, no sound, pressure is above systolic. You hear those sounds, and no sounds is pressure below the diastolic. Okay, top number versus bottom number. Okay, itself. Now, lastly, I want to talk about vascular disorders very briefly. and how they are classified. Now, vascular disorders, of course, we think about hypertension, diabetes mellitus can contribute to any type of vascular disorders. And especially when you think about hypertension, we're constantly pressing on the walls. Okay, that's going to change the elasticity. And then diabetes mellitus changes the porosity. Okay, it changes the thickness of our blood. Too much sugar turns your blood into mud. Okay, so think about that. So we're going from very thin blood to molasses or sorghum and how thick that is. And then if you change the diameters of that from a coffee stirrer straw to a smoothie straw, think about that, because the body's still going to do that. Okay, even if you have diabetes, it's still occurring, and then it's harder to get that blood around the body with the oxygen. The first one is your arteries coming apart, degeneration. Okay, so as a result of age, or obviously factors such as diet and exercise may be depositing those plaques, as we call them, okay, cholesterol onto the walls, within the walls, okay. Now, the name is called arteriosclerosis. So when you look at that word, look at it, it's got the word artery in it, okay, that's important. The back side of it is talking about the hardening. Okay, so hardening of arteries. Okay, so you think about, again, that elasticity, and that starts to deteriorate the vessel artery itself. Now, another disorder that I want to talk about in that video you would have already heard is going to be aneurysms. Now, a true aneurysm is classified as a bulging sac in the blood vessel walls caused by a localized weakness in that part of the vessel. Now, common sites are your aorta, and the vessels in the brain are usually the more common sites you're going to find the aneurysms, but you can have aneurysms anywhere. Now, it can come from different factors. You could be born with it, it could be congenital. You could be a result of that hardening of the arteries, or it could be from a trauma to the body. Okay, so an injury can also cause it. And that's the reason I mentioned it to the video, to really be thinking about an aneurysm. If that balloon popped, all that liquid that was going past it is then going to be going out, and you're going to have internal bleeding, and how dangerous that can be. But then you think about, okay, if I've got a bleeding, that's a hemorrhage. Okay, so any, lots of blood escaping from the vessel is known as a hemorrhage. So if an aneurysm breaks, that would turn into a hemorrhage. Okay, it literally means a bursting forth of blood. That blood can be either externally or internally is a problem. But we definitely think about, when you're reading the information, we're thinking about hemorrhaging. There could be various causes that could cause the hemorrhaging, but we've got to figure out a way to stop the hemorrhaging. Because if we don't stop the hemorrhaging, then our body is set up next to the word called shock. And shock has, of course, multiple meanings, but in the terms of this system, is a life-threatening condition in which there is not enough blood flow to the body tissue. And that sets up the word that I mentioned last week of ischemia. Okay, and ischemia is a lack of blood flow, it's a lack of oxygen. Lack of oxygen turns into gangrene, and gangrene turns into necrosis. Necrosis means the death of the cells. And definitely understand when we think about organs that if the cells are dying, that is the organ dying. Okay, and depending upon how many cells die within that organ, and if the cells could even come back through mitosis, you can see how that could be game-changing and life-threatening for us. Now, thrombosis is another name you will see in embolus. Now, a thrombosis is a blood clot in a vessel. Okay, we talked a little bit about this 2 videos ago when we talked about the blood system. We talked about platelets. So a blood clot in a vein is termed deep venous thrombosis. Okay, so the venous system are referring to the veins, okay, themselves. Okay, vaso usually refers to arteries usually, okay, and it most happens more often in the calf muscle is where you would see a deep vein thrombosis. Now, the problem with a thrombosis, we think of platelet, of that hemostasis, is if the body doesn't stop it and it blocks blood flow, then we get ischemia. Of course, it could go all the way to necrosis. But what happens when it breaks loose and then it follows through the body? That is when it's called embolus. Okay, and an embolus is just when a piece of the clot or the whole clot then loosens and floats in the blood. If it goes to the lungs, it's a pulmonary or pulmonic embolus, okay, and then we think about, obviously, if it goes to the brain, it's going to be a stroke, okay, vascular, cerebral vascular accident, better known as a stroke. Or if it goes to the heart, then that could cause, of course, a myocardial infarction. So some names I would have said in previous videos. Now, you can get inflammations that occur. So again, just look at the ITIS and the word before it. Okay, so we think about, of course, inflammation of the veins. Of course, that also then could lead to a blood clot. You get inflammation of the arteries. Of course, you can see the problems that would happen. Again, we're inflammation referring to those layers. Okay, usually it's the the intimate layer that we're talking about with the inflammation. Now, healthcare workers, if you're on the feet all the time, students, you're off your feet a lot, okay, until you get into clinicals. When you think about vascular problems, we also need to think about varicose veins. Now, varicose veins affect the more superficial veins, and that's where they can become very swollen, distorted, very ineffective, because it's not pushing the blood back to the heart. Now, a variation of that we don't always like to talk about with varicose veins is one of the rectum area, okay, the anal canal, the anus, called hemorrhoids. Okay, so hemorrhoids is in the rectum, varicose veins. Okay, now, and again, it's just because we think about the pressure that comes from these veins, the compliance happens, that stretchiness that does not occur. So definitely know what varicose veins are. We think about them more in the leg, but obviously, as you can see, they can be throughout the various areas of the body. So hopefully within this video, you notice most of the video dealt with, looking at the arteries, the capillaries, and the veins and naming them. But definitely make sure that you spend some time. You definitely want to send Manee within this video and baby Manatee obviously swimming with that oxygen to go to get what they need. Okay, so think about a manatee swimming towards lettuce. Obviously, they eat a lot of food throughout the day in order to sustain their life. The same thing with our cells. But the difference is our cells can't swim over. That's why every cell that is living in our body has a capillary bed right next to it, just like giving lettuce to a manatee so they can consume it. Okay, cells obviously do not go to the capillaries. The capillaries are there to give them what they need. Hopefully you've enjoyed this video, and me and Manee look forward to seeing you within the next video.